is that the buildup of the ecosystem for vaccinating is there, it's solid, and then the federal government now and our private partners, in that conversation I had with Alec Gorski at J&J, reassures me that there's a high degree of confidence that the supply of vaccine will continue to reach that higher level and continue to go up. And I think yesterday, President Biden's aggressive goal for us to reach the 200 million doses certainly sets the stage for that. So we're open for any questions you might have. Yes.
Can you guys go over the universe of people now that are now eligible for the vaccine? Because a lot of people in the age group now open would have already been vaccinated because they're in other categories. Yeah. And then also, how long do you anticipate that taking?
Yeah, well, first of all, it is exciting news. And when we looked at the different ones, you'd be surprised on how small maybe some groups are of those, under 50 with no underlying health conditions. That is a relatively small 100,000 or so people. What this opens up the entire universe to is about 4.4 million. Is the way that I think Jan is correct when we looked at the demographics. It adds to the queue, obviously, as we said, but as we've seen, that queue is not equally spread out in all parts of the state. And the thinking behind this is, with the large number of vaccines that are coming, it gives flexibility, especially to the providers. And I don't know, Dr. Jacob, you just gave me an example of one that maybe used that, of what that means, if that helps you where we're at on numbers.
Yeah, Abe Jacob, Chief Quality Officer, I'm Health Fairview. So I think what the vaccination expansion to the tiers, it does give the health systems in particular a lot more flexibility. You know, we would frequently run into circumstances where we could vaccinate a 65-year-old Latinx, but we couldn't vaccinate their 61-year-old otherwise healthy spouse. Now we can vaccinate both, and that makes sense to us, when we think about the risks and the risk we're seeing. And really, we're really going to be focused on the age 50 and above and those with chronic conditions. I mean, that's who we're seeing being hospitalized right now.
Governor, the initial frustration is coming from people who were on the cusp of becoming eligible, healthy, 50 to 64-year-olds, younger people with an underlying condition. They are frustrated that now people who they thought were behind them in line are now going to be competing with them.
Still.
What do you say to them?
This is where the providers, and we've said this all along, and this is where they've reached out to their folks and said, hey, you're eligible, come in. We're still asking them to prioritize those very people. If you've got a 68-year-old who just came back from Phoenix, wasn't able to get it down there, the expectation is they are still in the front of the line. We have made the line a little longer, but they're not competing against them. What we're asking is, and this is what we've seen happen, okay, we said you could only give it to 65 or healthcare workers. We found places that were setting then and had vaccine and said, well, we can't go to anyone else. And then what we want to make sure is that they're still hitting those groups. But if those folks aren't there, or there's no demand for it in the location that they're at, they move to the next. Because there's a significant increase that's coming. And again, this discussion we're having and those questions that are being asked there, they will take care of themselves within about the next 21 to 28 days because of the sheer volume that's coming. But they're not going back behind them. They're not necessarily competing against them. We're telling those providers to still prioritize the groups in that order.
To clarify, though, these are the people who are not yet eligible. They're on the cusp of becoming eligible, 50 to 64-year-olds, healthy. And they are frustrated that now they feel like people who were behind them are now going to be competing with them.
Oh, I'm in that group. Share with, I mean, we're all in this, and some are going to get it. And the idea is that there's not a statistically higher risk of a 50-year-old that's healthy with no underlying health conditions, much more so than a 35-year-old with no underlying health conditions. And so, again, if we have gone to the 50 and above with the groups you already have, Jan, correct me if I'm wrong on this, that last addition of those under age 50 with no underlying health conditions to age 16 is approximately 100 and...
That's slightly younger.
Of the entire group that's there, okay, of adding everyone in. So we knew, and I just want to be clear, the excitement about this is everybody's in line. This does go back to the beginning again. There are not enough for everyone to get it today when they want it. But what we have proven, I think, and it was the thinking when we first set out to build the system that we built, we knew we would get to this day. We thought it would be a little later, but the vaccine allotments have let us get there, is we didn't want to get to a point where we stopped dead or we weren't getting these things out fast enough. And at that point in time when we were designing this, the idea was to outrace the vaccine, make sure there wasn't a surge. Now I feel even more of a sense of urgency around that with the variants. So there will be a little of that. Will there be a few people that that felt like they could have gotten it a week or so earlier? Potentially, but the thing for me is the desire for folks to take this is so great that I don't want one vial sitting on the shelf, and I don't want one extra day to go by before somebody gets it. Yes.
This might be for the commissioner. First, I would like to get as specific as you can give us the dosage numbers that you are expecting for next week, for the week after that, meaning April 5th, and if in fact you're getting 3-week out projections from the administration the week after that, just the hard numbers, because it doesn't appear that next week you're going to see an increase in supply, that it's really the week of April 5th.
I'm going to have to get back to you on the very specific numbers. The math is a little tricky here because when the federal government is announcing these large-scale numbers, they're talking about a combination of first and second doses and a combination of what's coming to the state and what's going directly from the federal government to their channels. So we do have our estimates, but we don't actually know until after the fact how much the feds allocated into the federal retail program, for example. So of what we're estimating, we've had an average of about 330,000 total doses in the state, both to the state allocation and the federal channels. Over the last 3 weeks, we've averaged 330,000. What we're projecting for next week, but it is just a projection because we don't know for sure, those federal allocations, is that would bump up to 424,000. What we've also...
Coming Tuesday.
Yes, that would be, right. That would be for, that would be allocated to us next week for delivery the following. So what we know about this coming week is 322,000 coming directly to the state with an estimate then for the federal share. So, and we have been told by the CDC that the Johnson & Johnson supply is likely to be a little bit, their word, I think, was bumpy in the next few weeks as Johnson & Johnson is ramping up. So that has been the least certain part of the projections in the last couple of weeks, and will probably remain so for the next couple.
Okay, while you're there, can you tell us how you're communicating with providers as to how they should be prioritizing people today going on pharmacy sites, for instance? It was just first come, first served. There did not appear to be any attempt to say, what's your age group, things like that. North Memorial is still doing random among eligible people. So how did you communicate that, and how would you expect that they should be delivering on that?
Well, I think it's as the governor said and as Dr. Jacobs said, what we have, and I want to go back to Theo's point, providers will continue to use age and different gradations of age as a risk predictor, and will be prioritizing bringing their older patients in earlier in the queue. We have absolutely said to the providers, we are still needing to vaccinate for impact. This race against time and the race against the variants, we need to get the most vulnerable people protected first. But what this does do is give providers the flexibility of being able to, as Dr. Jacobs' example is a good one, to vaccinate family members when they come in together, or to vaccinate when they have reached their capacity, their patient population. They don't have to wait for permission before going to the next group. And that will vary a little bit from system to system, depending on their patient population, their geography, and so forth. So we are definitely asking the providers to continue to have an eye toward health impact and prioritizing around risk and asking and directing them to do that. We have said the same to the pharmacies, that they are to be prioritizing eligible populations. Well, now everybody's eligible. We know the pharmacies weren't really set up to do a lot of eligibility verification of where do you work, or do you or don't you have an underlying health condition. So I think it is an accurate observation that that there's probably less of that prioritization going on with pharmacies. But as we are talking with the federal government, where we're trying to get a line of sight to what are the priority populations and the priority locations for some of those retail pharmacy distributions too, because we can have sort of a line of sight to what parts of the state need an additional supply of vaccine, just given the population there.
Yeah, Commissioner Malcolm, if I can ask on that, you do have some control over the federal partnership, retail pharmacy partnership, in terms of where those doses are supposed to go. Are you directing those chain pharmacies to just give to everyone now, or to be more to scrutinize more?
We do have the ability to talk with them about geographic allocation, for example, and to ask them, when their stores are in locations where there's actually pretty good coverage already, pretty good saturation of the over 65 population, for example, to ask them to move more of the supply into their population center locations, for example. But the amount of vaccine is totally set by the federal government for those retail pharmacies.
Governor, if I could ask, how much of a concern is it at this point that some workforce sectors specifically have shown resistance to receiving a vaccine? Anything the state is planning to do to change minds, and how much of a role will that play in this 80% goal that you've been touting? It'll
play a lot, and I just think that there is a spectrum on why folks aren't getting the vaccine. It is not necessarily ideologically rigid against vaccines. Some of it is a hesitancy early on. I asked this of a younger workforce when I was in one of these, and their design, this was about a month ago, why they hadn't been vaccinated yet, and they said they didn't feel comfortable about it when others were still waiting. So the one thing I will have to say is Lieutenant Governor Flanagan is down in Worthington today at some of our protein processing facilities. The uptake on there has been spectacular. What we're seeing, we have tens of thousands done at one facility. I think we had an uptake near 90%. One of the things I do think that you're going to see, and this will be very visible to all of you, there will be a much more visible campaign around getting vaccinated now. It didn't make sense to run that campaign when we had so many people waiting in line and so many people that there wasn't the hesitancy. At least you couldn't see it because vaccines were getting out. We've known all along, we've talked about it for months, that, to be very honest, this question is the one that we asked clear back in December. That day is going to arrive when we have more vaccines and we have people to take it. It needs to arrive after we've reached 80%, and that is not going to happen without a lot of tools. So there will be a campaign around having validators both in local communities, the celebrity validators, social media. There's incentives, and we've seen many large employers incentivize their employees and say, hey, we'll give you a day off if you get vaccinated, or they add it to their paycheck. We're working with those sectors to try and understand why there's resistance, to try and figure out if there are incentives to get people there. The one thing in long-term care, Commissioner Malcolm, we did 3 sweeps through those. Obviously, the uptake amongst residents was much higher than the staff. Our staff uptake on long-term care is still a concern for me, but it mirrors the national trend on this. So I think one of the things the governors are talking about, the federal government's going to do the same thing with a coordinated effort around public service announcements and things to get people to take the vaccine. We're asking to make sure that it's not duplicative, and one of the things that I am absolutely convinced of, you need folks close to you who you believe to be able to tell you this vaccine should be taken. So you're exactly right. You're going to see a much more concerted effort. You're going to see it on many fronts of trying to get folks to take it. I'm making the plea to Minnesotans. We end this thing by taking the vaccine. I quite honestly understand some of those frustrations of waiting in line, but I have to tell you, I'm okay that people are excited about getting this thing. I'm okay that people are saying, hey, get me this vaccine as quick as possible. That is a much better scenario than if we get to a place where we don't approach that 80% and people are no longer taking it. So it'll be on many fronts.
Governor, when are you getting vaccinated?
I'm sorry, actually, this is a question related to a different subject matter, but I did promise the family I would ask. In the news this week, there's been some talk of this $3 million settlement to go to Joseph Gom's family, the corrections officer who was murdered in 2018, and the family specifically is asking you to intervene on their behalf to pass this settlement, and I'd just like to see if you could comment on that matter.
On these active cases, I'm not going to say anything that would prejudice this one way or another. What I will say is the loss of Joseph Gom in doing his duty in our corrections facilities is a heartbreak. It is still with each and every one of us, and trying to find an equitable place where the family feels like they have been listened to, respected, and comes out of this in a way that they feel is acceptable. I don't want to weigh in at this point in time, but can tell you that my concern to make sure this family is cared for, the changes that came around in how our corrections facilities work since the murder of Officer Gom has been put into place, and so I'll follow it closely, but I don't want to prejudice that. I had a question over. Yes.
Governor, I was asking when you're getting vaccinated.
Soon, I hope. I am now in line. I'm excited like every other Minnesotan. Coming out of quarantine today, I am with all of you. And again, I want to thank the press who was there for following through on that protocol, making note again that exposure 2 weeks ago led to no other cases. And so that was because of the masking and the protocols by a lot of the folks in this room. And so I'm going to get on, signed up, get an opportunity to get out there. I want to make sure Minnesotans know how excited I am and my family is to now that we'll be in line on Tuesday.
Governor or Commissioner, some vaccines have been approved for 16 and 17-year-olds, and I'm curious how teens or parents should navigate finding those specific vaccines for those kids.
Yeah, and this is one, yeah, because I will get this wrong if I say the Pfizer or the Moderna. One is 16 and one is 18. Maybe, yeah, we'll give our expert on this.
Yeah, so it's a really important point because there's a risk of vaccine error if we don't get this right. So Pfizer is approved for 16 and above, Moderna and Johnson & Johnson for 18 and above. And so, you know, because of the varying supplies we're getting week to week, and now that we've seen this expansion, we're going to have to be very careful about making sure that the right people who are indicated to get the vaccine are getting the right vaccine. It's a vaccine safety, you know, issue for the healthcare providers and the pharmacies or people who are giving the vaccine, is to make sure that lines up. I think initially, to the previous question about this question of jumping the line, you know, people at higher risk now feeling like they're, you know, I would say my 16-year-old healthy daughter ran up to me yesterday and said, "Dad, can I get vaccinated on March 30th?" And I said, "Not by our health system, because we're still going to focus on the highest risk folks. We're going to get the 50 and above. We're going to get those with underlying conditions. And as we see supply and those appointments open up, we will expand those age categories and those risk categories. So it's going to still take us a little bit of time to make sure that the supply is meeting the demand. But like I said, I think in the next 4 to 6 weeks, a lot of this is going to just really settle out and flatten out, where then we're going to be coming up here talking about vaccine hesitancy. We've got plenty of vaccine available. We need more people to get vaccinated to actually get to herd immunity. So we're really hopeful, looking at, you know, what we're seeing as the future numbers, but we're really going to be focused on those high-risk patients, and we have a lot of outreach strategies planned. We're going to get out to those patients and make sure they get vaccinated.
I have a question for either the governor or the commissioner. You guys can flip a coin. Did you make a conscious decision to try to bring younger people into the queue because of the recent infection activity among that population group?
Good question.
You know, I don't think I could say that there was an explicit calculus about that, but it's certainly helpful. The more we can get vaccine into the places in the community where we are seeing spread, whether that's geographic or certain age groups, the better. I mean, and certainly this does immediately help us begin to target vaccination at the parents of the kids, for instance, who are in school and participating in extracurricular activities. We are, I know this wasn't precisely your question, but I think everyone's aware that what we're talking about here is, as Dr. Jacobs said, the lowest age group currently eligible for the Pfizer vaccine is 16. There are trials going on now for younger ages down to 12, and in the case of Johnson & Johnson, they will be testing even younger ages later. But we're hopeful that by sometime in the fall that there will be vaccines available for probably the middle school and high school ages. But just to reinforce that right now we are talking about fairly limited group of younger folks who would be eligible.
Peter, it's a good question, and I think it goes to, as we're following CDC and ACIP guidance, the medical ethicists and how this worked, we built this plan back in December when we knew the vaccines were coming with it holistically of what the end would look like, and there was a point on that chart as we're whiteboarding it that said all Minnesotans eligible. At that point in time, to be candid with you, we were thinking August is what that looked like. But we were plugging in what they were telling us of these are the groups that need to go first, these are how you you vaccinate for impact, and start plugging them in. Now, there have been certain things that have happened during this that have kind of, shifted and moved. One of the biggest things, though, is that we stayed true to this idea that you needed to build an infrastructure that had the capacity to take in 420,000 vaccines, 600,000 vaccines, and that it would be about speed of moving everybody through that. And so I think there's an added bonus here around this, that we came to this time, and it was the logical sequence of where things were, but it now is, and you're exactly right, it is that younger age group that is spreading the variants. And so if they can get in here, and again, I can't tell you how incredibly exciting it is to me that this isn't August. And then a few weeks ago, it looked like, it would be June that we put out. And then President Biden said, you need to get everybody in May. And then because of the vaccine numbers that we have, we're able to do this today. I'm not certain that all states are here, nor should they, if they don't have the capacity or the ability, or if they have not reached 80% of their seniors, they probably shouldn't. We're just in a little different space.
Commissioner, I'm on the Scene Spotter website. I'm sure you've probably gone to it. It's a sea of red in the metro area right now, as far as places that are pharmacies that are offering a shot. If you're in the metro, you have to go to Fergus Falls, is the closest one where they're showing an available appointment at a Walmart pharmacy, which is the same problem as several weeks ago still. What is being done to reallocate where there is excess supply outstate and bring it into the metro?
Yeah, and I maybe have you talk about this. This is that issue of, again, building this pretty complex system that moves these things almost in real time to make sure we're focusing on equity geographically, we're focusing on equity racially. Those social vulnerability index played a role in this, and then vaccine uptake by folks. And these numbers and this thing you're looking at, that Theo's looking at, can change relatively quickly. And that's why we're getting, and when we have these conversations about allocations, I get a call every Tuesday night after these have been made by the groups and say, this is our potential allocation. Are we signing off on it for Wednesday? So I'll let you talk about this. One has been coming up the last.
Well, it is a balancing act, to be sure. I mean, we have always had an eye to geographic parity to some degree, to say, particularly early on, we were targeting vaccine. Where are the healthcare workers? Where is the long-term care population? Got a little more complicated as we started opening to 65 plus and people with underlying health conditions. And now we are tracking, what is the percentage of the target population or the eligible population that has been vaccinated down to the county level, and having conversations each week about, and frankly, we need more information to understand, is the reason why one county is lagging behind another. Is it a supply issue? Is it a vaccine hesitancy issue? So we are continuing to gather more data from our healthcare partners in particular, and pharmacies, to see to the extent that they are giving us real-time data about how quickly their appointments are filling, for example, and if we do have parts of the state where there is unused supply, we are having those conversations to reallocate to the metro area. It's one of the strengths, frankly, of working with the coalitions of healthcare providers. We haven't talked about this for a while, but Dr. Jacob made reference to it. The 10 largest health systems are working together in a collaborative coalition, and they are in a great position to help, help with that balancing and moving things around their collective system much more quickly than we could from a state level. And the same is true with the 8 geographically regional healthcare coalitions that are playing a significant role in helping us to get the vaccines to the right place.
Do you have the power to tell these chain pharmacies, many of which are in the federal program, to reallocate? We
can request it. We can suggest it. We don't actually have the ability to tell them move this many doses there. It's really more of a conversation and a suggestion.
Are they doing it when you ask?
I beg your pardon?
Are they doing it when you ask?
To a significant degree, yes. I mean, I couldn't tell you down to the level of the dose, but they have been very receptive to moving things around their stores to try to help with this geographic balance.
If I could follow up on that, this is something, I think this is out there for information for all of you, but the White House briefed us on this. Pfizer has agreed, and they're in the final stages of repackaging how they send this in smaller increments. That has been a real drawback for us, that it had to go in the 980 pack, and of course the cold chain around Pfizer and Moderna causes some of these issues where we can't just say, let's just ship some over there today. They're going to shrink that down, I believe, to 200 dose packs that will make it easier to move those. And this is where the J&J, and again, this was fascinating to me when I talked to the J&J CEO of being very clear about this. He said, we're really good at this, but there are, for obvious reasons, multiple layers of safeguard about these things. And he said, we're not making widgets. We are growing these in big vats. And one of the things that's worrisome is these big vats supply hundreds of thousands of doses in that vat. If that vat goes bad for some reason, all of them are thrown out. And that takes about, what he's, to me, 2 to 4 weeks in the growing period of these batches that they're growing. So we're getting projections on the vaccines that we're going to get 4 weeks down the road that are still in vats. They got to leave the vats, they got to be certified by FDA, they've got to be bottled, they've got to be shipped, they've got to be gotten into arms. And so one of the things of moving these around is the cold chain responsibility around Pfizer and Moderna has made it harder. J&J allows us to do that. And this federal piece of it is they have been pretty good partners with us on this, but this has been a complaint that governors have made, that we don't have a real good sight picture into exactly how many of those are going out and where they're going. Early on, if you remember, in the first couple weeks where Minnesota looked like we were lagging, it's because the bulk of those vaccines were in the big pharmacies and they weren't giving them out. And what they were doing in many cases, nothing bad here, they were setting on their second doses, and we started to look and see, well, why are some of these states doing so much better? Because they weren't ordering the second doses. And so they weren't setting on the shelf and they weren't getting measured against them. It was a mirage of how fast things were happening, but it was very frustrating to states that we couldn't see that picture. And so I think there's good communication there. I think we're working together on this. Theo's point is this, right? I'm very cognizant about making sure all areas of the state get it. But just to be candid, we have uptake. We're finishing in some places, if you will, with the groups that are there in certain counties. So it should make sense for us to move those down. And this is especially true of folks who maybe are depending on public transportation to get there. Their mobility is limited. They're in socially vulnerable indexed areas. We need to then move that vaccine, get it into there, and put it into the hands of folks who will get it done.
As we get more and more vaccine in the state, is there any cap or limit on the daily amount of doses we're able to give out just because of numbers of people?
That's a great question. My guidance was that there should not be, or it should be very high when we built this thing.
I think that we had earlier quantified with our healthcare systems, community pharmacies, local public health, kind of the usual vaccinator channels, if you will, that at full capacity there would be the capacity to do 500,000 a week. With that kind of regular infrastructure. Then you've got the state-sponsored sites in addition to that, or additional community-based sites that we will see more of that kind of community pop-up sites like are happening in Worthington right now. And then you layer in workplaces that are willing and interested in doing the vaccination. So we've kind of got this the steady state of about 500,000 a week with the ability to supplement with state sites, for example.
Dr. Jacob, if I can ask a question for you. I guess I was wondering, when the rubber meets the road, say some intrepid young person figures out how to get a vaccine appointment even though it's not on your priority list, what are you going to do? Are you going to just proceed with it and let that person get the shot, or reschedule them?
That's a really good question. I'm hoping this is just a, like I said, a 3 or 4 week problem, you know, where this whole jumping the line is it's a daily thing we deal with every day. And this is just when anytime you're essentially rationing, which is still a scarce resource. The point is we want Minnesotans vaccinated. And now that the criteria have opened up, you know, if we have the ability to say, you know, that slot is reserved for a 51-year-old or a 45-year-old with diabetes, can you wait a week? Can you wait 2 weeks? Can you wait 3 weeks? That would be our preference. Now, if that vaccine slot's going to go unused, then that gives us the ability to say, you know, to do more real-time vaccination to make sure, to the point that we have no vaccine left on the shelves at the end of an allocated week. So this is going to be tricky, but again, the expansion gives us a lot more flexibility to focus on our highest risk populations and yet start to fill in some of the gaps if we have vaccine on the shelf to be able to offer that to people who qualify. But our primary focus is going to still be on those highest risk populations, and I don't see that going away for the next couple of weeks. There's still significant demand in terms of our appointment slots by those higher risk populations, and that's going to be our focus.
Can I just get a clarification on that, Doctor? Are you saying that up until now you have had the capacity to deliver more vaccines than you've actually been able to put into people's arms, or am I misreading?
No. I mean, we're giving out 100% of our vaccines to within 7 days for sure, and most of that within 3 days. So the demand is much higher than the supply.
Thanks, Dr. Jacob. And you're right, and this question is good about the 500,000. Again, we built this thing with the intention, and it's our direct guidance, that 90% of those are out within 72 hours and all of them are out by the end of the week. That didn't matter when we were getting 20,000 doses, or it won't matter when we're getting 500,000 doses. That will try and stay the same. Now, that's very difficult and it gets harder. Some of you are doing the math in your heads right now, assuming we get 420,000, and even if that doesn't increase, you're seeing the 1.7 million doses. So the stories of waiting in line and we can't get in, those are going to be gone in 4 weeks. But the real story that got asked early on is we need to keep that demand continuing to stay up. We need to continue to educate, ask, cajole, whatever it takes to get everybody to take this. You can start projecting out. If Minnesotans keep doing what they're doing, and if the rest of us follow what the 65 plus did to get to 80% in the time they got, you could start projecting out where Minnesota should be approaching between 70 and 80% of the population vaccinated. The really exciting news about that is that's not that far off if this continues to go this way. So I'm just going to end the conversation today with an ask, as I've done for many times over the past year, Minnesotans. Please, if you can get the vaccine, take it. Please have a little patience if you're younger and healthier, but don't pass up this vaccine. All three are very good. Use the sites, help neighbors get this. Let's get this thing done. The sooner we get to 80%, the sooner is this thing's over. We close the books, we close the doors, and we go back to doing the things that we need to do. We have lessons learned. We're going to live with this for years to come. We're going to test for it for years to come. And more than likely, and this is what, you know, the folks at Johnson & Johnson and Pfizer and the doctors tell me, we're probably going to get yearly boosters just like we do our flu shot. But just like we got our flu shots, none of us really remember getting on websites jammed up with hundreds of thousands of our neighbors to get the flu shot. There's an infrastructure built that will just move those things out just like we're doing right now. So we've got this where we needed to, Minnesota. We've got the infrastructure to do it. The federal government is coming through with good partners. We've got numerous channels for you to receive this. We just need you now to take the shot. Roll up your sleeves, take the vaccine, and let's get done with this thing. So thank you all. Dr. Jacob, thank you again.
Appreciate your insight. And thank you.
And I like the switch and rolls that we have today in this moment. Okay, Governor Walz, just 2 weeks ago, you surprised me with a special day. March 9th, my birthday. I was shocked and surprised when you recognized me, and that's something that will be a memory that will live in my heart forever. I find it a little bit ironic that I now stand here after a year of being with you, recognizing the diversity that you have recognized and the work and passion you've given as you've come before us. I've seen your pain, I've seen your passion, and making big decisions and commitments, and your commitment during COVID-19, but also then with the George Floyd murder. You kept calling me over and over again to give access to many Minnesotans in my community. And access, I know, is something that was intentional and heavy. But at the same time, you knew the importance of access. So I want to recognize that today. So today, it is my honor that Minnesotans in my deaf, blind, and hard of hearing community has now asked me to stand before you and give you an award, the Access Award. So I would like to read it to you. The Access Award acknowledges that the office of Governor Tim Walz and Lieutenant Governor Peggy Flanagan has been recognized